Why are CF hospitalizations so frequent? Imagine living with a condition that constantly challenges your lungs and requires ongoing medical attention. That's the reality for many with cystic fibrosis. This disease causes thick, sticky mucus to build up in the lungs and other organs, making it hard to breathe and increasing the risk of infections. Because the mucus blocks airways, bacteria can thrive, leading to repeated infections and inflammation. Over time, these infections damage the lungs, reducing their ability to function properly. This damage makes flare-ups more likely and more severe, often needing hospital care. One of the main reasons for frequent hospital stays is pulmonary exacerbations. These are sudden worsening episodes where symptoms like cough, sputum production, and shortness of breath become much worse. During these times, doctors often need to give intravenous antibiotics to fight infections and perform airway clearance therapies that are difficult to do at home. These treatments help reduce inflammation and clear mucus, but they usually requiring hospital stays to be most effective. Persistent lung infections, especially with bacteria like Pseudomonas aeruginosa, play a big role in causing ongoing inflammation and damage. This ongoing battle with bacteria means that patients often experience repeated flare-ups that need hospital care. The severity of lung disease also influences how often someone needs to be hospitalized. Those with more advanced lung damage or lower lung function tests tend to have more frequent and serious exacerbations. Treating cystic fibrosis is complex. It involves a combination of therapies like inhaled medications, physical airway clearance, nutritional support, and sometimes intravenous antibiotics. Hospitals provide access to specialized teams who can deliver these treatments safely and effectively. Because CF affects each person differently, some may have frequent mild episodes, while others experience fewer but more severe episodes. Doctors use tools like lung function tests to monitor and predict risks, but hospitalizations remain as common because managing severe episodes often requires intensive treatment. Even with advances in care, hospital stays are still a vital part of managing cystic fibrosis. Improvements in treatments have helped people live longer and better lives, and hospital care has become more effective with better infection control and supportive therapies. Still, the chronic nature of lung infections and ongoing inflammation mean that hospitalizations are often necessary to keep symptoms under control and prevent further damage. In the end, frequent hospitalizations happen because cystic fibrosis is a complex, progressive disease that causes repeated lung infections and inflammation. These episodes are tough but manageable with proper medical care. Always remember, each person's experience is unique, and ongoing research continues to improve how we treat and support those living with CF. If you or someone you know has cystic fibrosis, it's important to work closely with healthcare professionals to develop a personalized plan that addresses individual needs and helps manage symptoms effectively.